The harm is huge. Even though we are in Canada, we are absolutely going to be fielding questions and trying to mitigate the harm.
Medical experts, including Health Canada, are now denouncing U.S. President Donald Trump's claims about Tylenol and links to autism.
Well, let's see how we say that. Acetaminophen.
It's acetaminophen, the active ingredient in Tylenol, which the U.S. president recently took issue with.
Tylenol during pregnancy can be associated with a very increased risk of autism.
But Health Canada disagreeing, releasing a statement saying there is no conclusive evidence that taking acetaminophen will lead to autism or other neurodevelopmental disorders. In fact, it is a recommended treatment of pain or fever in pregnancy.
Medications such as Advil, naproxen, they do have potential harms, and so we don't want people turning to those.
Dr. Natalie Forbes, a community pediatrician in Calgary, says there are limited options for pregnant women for pain relief, and misinformation like what Trump said about Tylenol could cause people to seek other treatments that are unsafe for them. But following Trump's comments, she now also worries for families with kids that have autism.
Every woman who took Tylenol during pregnancy and subsequently had a child diagnosed with autism is now going to be second guessing that choice and feeling guilty about it, which is so painful and so detrimental and so unnecessary. It's cruel.
The conversations that are being brought up are really quite archaic. They're a look at autism from a very negative-based lens rather than looking and celebrating at the differences and the gifts that our children and our autistic adults bring to the community.
Autism advocates say the U.S. president's comments may be a distraction to reforms they've been calling for that result in positive changes.
We need to focus on looking at what's needed, addressing the wait lists for early interventions, making sure teachers are equipped with the aids and the professional services they have to ensure students have the best outcomes and children can reach their potential.
In Calgary, at Djan, City News.